Let me know if anything makes you feel uncomfortable, okay?
Yes, ma'am.
All right, Mr. Cray.
Reverend Cray, actually.
Okay, Reverend. How old is Lindsay?
14. Now, how long was this going to take? And I'm only asking that because we got to get down to Cedar Rapids. I'm preaching at a revival meeting tomorrow.
Okay, we'll just figure out what's going on here first and take it from there.
Have you ever felt pain like this before?
Her last pregnancy, she'd get sick like this, but not with all this blood.
Last pregnancy?
Lindsay, what happened with your last pregnancy? Did you carry to term?
She'd had what they called a spontaneous miscarriage. That was 4 months ago.
Well, it doesn't look like she's pregnant now. However, I am seeing some irregularities in the lining of her uterus. Perhaps something that didn't move through when she had her miscarriage. All right, I'm gonna do a pelvic exam now. Are you all right with that?
You can come outside. There's a waiting area. We'll give your daughter a little more privacy.
My daughter? Lindsay's my wife.
This marriage is legal? That guy and a 14-year-old girl?
Her father gave us consent, and a judge signed off on it, so yeah.
What about her mother?
Now, she died when Lindsay was only 3.
That man should be arrested.
Right, but on what charges?
Rape, coercion, whatever. This girl is a kid. She obviously had no choice in the matter.
He barely lets her speak. Can we call in the police? Family services?
Well, unfortunately, we're required to respect Michigan state law.
How's the girl doing?
She's undergoing a DNC to get rid of any products from her prior miscarriage.
Yeah, which the Reverend only okayed because he wants Lindsay to be able to conceive as soon as possible.
I realize this is distasteful for all of us, but I implore both of you to do your best not to let your personal feelings interfere with the care of this patient or the law.
Hi. How are you feeling, Lindsay?
I'm a little groggy still, but I feel better. Thank you, ma'am.
Is everything okay with her?
Well, that's what I came in to discuss with you both. The gynecologist found a tumor growing within the tissue that would have become the placenta.
Tumor?
Yes. She sent it to pathology. It is, I'm afraid, malignant. It's called a choriocarcinoma.
I have cancer?
Thankfully, it's still confined to your uterus. That's what's called stage 1. Given that we caught it relatively early, these tumors generally respond favorably to chemotherapy.
And if that doesn't work, what happens then?
Worst case scenario, we would need to consider a hysterectomy, but we are far, far from even discussing that.
See, first she comes in here, talks chemo. Next, she's scheming to remove your womb altogether.
I can assure you there is no scheming going on.
Chemo can lead to infertility.
Not necessarily. Yes, there are some risk factors, but to do nothing at all would be far, far riskier.
No, thank you, then. We will not be doing any chemotherapy.
Sir, I'm going to ask you to step out for a moment so that I can discuss this with my patient privately.
Why? She doesn't want me to leave. Go on, ask her.
He can stay.
Like I said, only thing we need from you now, doctor, is to get Lindsay discharged.
I'm not sure I should be talking to you alone.
Is that what he told you? Listen, I'm not sure how you feel about being married, but the one advantage that it does give you is that you are considered by law to be medically emancipated.
Emancipated?
It means you have the right to make your own medical decisions.
Does chemo really make it so I can't have a baby?
No, and Lindsay, it's clearly your best and safest bet in moving forward.
What are you doing?
Nothing.
I was just conferring with my patient. Lindsay, regardless of what this man thinks or wants, it is your body and your choice. So what do you want to do? Sir, get your hands
From the
off
start,
of me.
you have been willful and argumentative.
My patient has the right to decide how she wants to treat her cancer.
The cancer is you. You've been treating Lindsay like she's a child, not a woman.
She is a child. She's 14.
Just because you had some judge sign off on what's obviously a case of
I need to
abuse
talk to
does not
somebody in
magically
charge here.
decree her a woman. And now you want to play games with her health? You are a bully and a predator.
I'm the charge nurse, sir. How can I help you?
Yes, I want this bitch removed from my wife's care.
You're absolutely right. And again, I want to apologize for Dr. Manning's behavior. It was entirely unprofessional.
Very aggressive, it was pushy.
Yeah, well, between you and me, this is not the first time we've had a problem with her. She can get emotional. Women, right? I have to check up on a patient in orthopedics. Monique, help Reverend Cray here with discharge paperwork, would you? Patient's name is Lindsay Cray. Monique will take great care of you. Good luck and God bless, Reverend. I will be praying for you and your wife.
Thank you.
You're very welcome.
Where's the Reverend?
He's filling out the paperwork needed to take you out of here. I can't keep you here much longer. I know you have some big decisions to make, but I won't be able to get you the medical attention you need unless you speak up right now.
My mother died when she was 19. She had ovarian cancer. My great-grandmother, too. Guess it's the family curse.
I'm sorry to hear that.
The lady doctor said something earlier about a hysterectomy.
Dr. Manning, yes. Now that is only if you get sicker. With the right medicine, you have a great chance of beating this. You can live a long life, have a family someday.
Are those things I'm supposed to look forward to? No, I want a hysterectomy.
A hysterectomy is really not necessary at this point.
I don't care. Some women have their breasts removed if they have the cancer gene just so they don't get it later, right?
But you are so young. A hysterectomy is irreversible. You will not be able to become pregnant and have children, ever.
You don't know my life. You don't understand. I don't want to bring a kid into this world. Dr. Manning said it was my decision.
What is going on here?
Lindsay has decided to have a hysterectomy.
Over my dead body. She is my wife. I make the decisions.
Sir, please move.
You lay so much as a finger on her, and I will sue you to kingdom come.
We have her consent.
You lied to me. She can't make that kind of decision for herself. She was obviously coerced. He forced you to sign this, didn't he?
No. It was my decision.
You have 2 seconds to step aside, Mr. Cray, or I will have you forcibly removed from the premises.
You go through this, Lindsay, and you will be banished by the church, the community, everything. You will be diminished in the eyes of the Lord. Do you understand?
Hi, I'm Sonia. I'm gonna be checking on your...
Sonia Jimenez. It's me, Dana.
Oh, my God! Dana, hi!
Honey, Sonia and I went to high school together. She was a princess in my homecoming court.
Small world, okay. Mitch McPherson, pleasure. Honey, I have to take off now. You give me a call if you need anything. Love you.
I love you too. I love my flowers. Thank you.
Does it hurt? Any numbness or tingling?
So you're a doctor now. Wow.
Well, actually, I'm a nurse, but I love it. It's great.
Good for you.
How's your pain today, Dana?
I'm really more embarrassed than anything else. Take it from me. Do Do not try to answer your iPhone while riding a horse.
I'll keep that in mind.
Yeah. Don't you just love Louboutins?
Yeah.
I don't know whether to wear them or screw them.
Sonia. Sonia. Yeah. Patient in room 509. We have some sort of a colostomy overflow situation. Pretty gross. So if you wouldn't mind going ahead and...
Yeah, got it. Yeah. I mean, who goes riding in those kinds of shoes anyway?
Hmm?
She said she fell off a horse. Hey, do you have Dana Harper McPherson's x-rays yet?
Yeah, here you go.
Thanks.
Ooh, that ain't good.
Hey, Jillian, could you come take a look at these for me?
Oh. So 1, 2, 3, 4. I should go have a talk with her.
I'll do it. Dana? I got your x-rays back.
Oh.
You have a lot of previous fractures. What's up with all the broken bones?
Why are you reading my x-rays? Are you a doctor all of a sudden? You go to medical school in the last 10 seconds?
Dana, you live in Manhattan. What are you doing coming across the river to Mercy?
I'm asking myself the same question.
All right, it's part of my job to ask you this. Do you feel safe at home?
Oh, really? Seriously? Are we in a Lifetime movie now? That's what's happening?
Dana, if your husband is abusing you, I have to report it to the police. I have to report it even if I suspect it.
Report what? If this is your way of getting back at me for winning homecoming queen, it's pitiful.
You're diaphoretic.
Okay, you know big medical terms. Congratulations.
Means you're all sweaty. Dana, what happened to you? There's something going on beside your arm. You're tacky.
You're tacky. Nice nurse shoes.
Help! I need help in 508!
Doc, huh? She talked all right. What did she call you again?
Well, I believe it was Paul Blart Mall Cop. Charming woman.
What about her husband, Zip?
Yeah, I'd like to have a word with him.
He gave her a stage 4 liver laceration. The bleeding almost killed her. I had my friend sneak a look at her records at Mount Sinai. She's been in and out of their ER 7 times in the last 2 years.
Too bad. Well, we know how this ends. But if she changes her mind, give us a call. See you, Sal.
Thanks. So the cop said you wouldn't talk to them. Why are you protecting him? The Dana I knew in high school would not stay in a situation like that.
Yeah, I guess you would know about staying in bad situations. By the way, how's getting out of Jersey City going for you, son?
Maybe we should talk later.
No, we shouldn't.
Fine. I tried. Good luck, Dana. You remember when we were running for homecoming queen and you told everyone the weird French teacher got me pregnant?
You came back from summer school chunky. It was a reasonable assumption. What's your point?
My point is, you were fierce back in the day. I mean, you took no prisoners going for that crown.
Yeah, well, you were no saint yourself. You totally laughed at me when I tripped on my gown and hit my elbow in that stupid water fountain.
It was funny. In a poetic justice sort of way, but I shouldn't have laughed.
No, you shouldn't have laughed. Number one, I was wasted, so it wasn't even my fault. And secondly, it actually really... It actually really hurt.
I know it does, sweetie.
Did you just call me sweetie? Oh, God, this is worse than getting my ass kicked.
There's a Dana I remember.
I don't think I can live like this anymore.
You don't have to. You can leave him. You can start over. You can do whatever you want. You're Dana Harper. Hey. Dana, your husband's here. You don't have to see him. I can call security and get the cops back in here in no time.
No, I want to talk to him.
I don't think that's a good idea.
I'm gonna tell him it's over.
Well, that's good. That's really good, but guys like your husband, they're manipulators. Maybe you should have a social worker in here with you.
Sonia, I'll be fine. Please go get him. I don't want to think about this too much first.
Okay. But I'm gonna leave the door open. And if you need me, be right outside.
Okay.
What the hell? What happened?
I don't know. We need Harris. I need a guardian now.
What happened?
Penetrating wounds to the carotid. He's non-responsive, but I've got a pulse.
All right, Angel.
Gurney, let's go.
Call the OR. Tell them we're on our way up. All right, let's get him up on the gurney. 1, 2, 3.
Emergency coming.
All right, let's go. Move.
Dana. You guys mind if I?
Was there anything that led up to the attack?
He came at me. He was gonna hit me. He had that look on his face.
But he didn't hit you.
But he was going to. I know that look.
Did anyone see this? Because it's going to be his word against yours.
I saw it. He went after her. I was trying to come into the room to stop it when she stabbed him. She was defending herself.
You give us a statement, Saul?
Yeah, sure.
Okay. We'll get a restraining order on him by the time he gets out of the hospital. But you should get out of that house, ma'am.
I will. Thank you.
Yep.
Her stomach's been hurting her for a few days now, but an hour ago, everything just went haywire. She's been screaming in pain. She gets really confused.
Abdominal pelvic ultrasound? On it. Okay, Allison, can you tell me exactly where it hurts?
I just got braces put on last week.
See the confusion, and her eyes, she can't even focus.
It's called nystagmus. Is she taking any drugs?
No.
Has Allison started menstruating?
I don't know, maybe.
Is she sexually active? Could she be pregnant?
She's only 13. Look, I don't think so. I'm just a stepdad.
Allie, baby, I'm sorry. I came as fast as I could. Baby, what's happening? I don't understand. She said she was feeling better when I left for work.
Not seeing any free fluids, no ovarian abnormalities. Let's do CBC, CMP, chest X-ray cultures, head CT, tox screen, blood and urine, and a serum pregnancy.
Oh, wait, pregnancy? What? No, Allie is still a virgin. She hasn't even started talking about boys yet.
I understand, but these are standard tests. We just need to run them to be safe, okay?
Can you just give her something for the pain, please?
I'm sorry, but we can't do that until the tests are finished.
Baby, what's going on, huh? Wait for me!
We will figure this out, okay?
Okay,
I'll be back shortly.
You update me on Allison?
White count's moderately elevated, but her fever's rising and she's disinhibited with a decreased level of consciousness.
A drug overdose?
Tox screen was negative, as was every other test. Pregnancy, urinalysis, chest X-ray, CT, pelvic ultrasound.
Neurologic infection. Meningitis, encephalitis, you get an LP?
Just did. CSF was clear. Whatever this is, it's viral. The lab's running a PCR.
Okay, keep me posted.
Hey, Doris told me you matched in emergency medicine. It's awesome.
Way to go, Clark. Good to have you.
Thanks. Hey, there is something I've been meaning to talk to you.
Natalie.
She's seizing!
Oh my God, make it stop.
To a Ativan.
Got it. Stats are dropping. 77, 76.
Allison, can you feel this?
I need to intubate. No drugs. Her jaw's loose. Okay, almost. Yep.
No, you're gonna choke her.
She won't be able to breathe otherwise.
I'm in.
Okay, I got it.
Secure the tube and start bagging. Stat chest X-ray and call up to the pediatric ICU for a bed.
Wait, I see. What's going on with her?
Hey.
Allison's LP results. Encephalitis.
Oh my God, HSE?
Yeah, fever, neuro issues, seizures, now the coma. Virus fits the symptoms.
Yeah. I just didn't see it coming. I mean, she's 13. Herpes?
Allison has HSV type 2, which is more commonly associated with genital herpes than oral.
Genital? No. Allie doesn't do that. And when, where? She's either at school or at home with one of us, right, Kevin?
Yeah, look, I work from home. Nothing's going on at the house. Okay, no boys come over ever.
I know girls don't tell their mothers everything. God knows I didn't, but Allie and me, we talk.
Have you noticed any change in Allison's mood or personality in the last few days?
No. Besides being sick, she's been her usual happy self. Why?
Allison's abdominal pain is inconsistent with the HSE diagnosis, and it may be a sign of sexual assault.
We'd like to perform a more extensive pelvic exam just to be sure.
Is that really necessary? I mean, come on, it's not gonna have any effect on how you treat her, is it?
There may be some internal damaging and bleeding that needs to be repaired, and it is possible she may have contracted another STD.
Look, can it just wait? Can it wait until we just have a moment to figure out?
It's okay. It's okay. You can perform the exam.
Are you sure?
Yeah. If this is that, I need to know. I'm sorry.
Baby.
We'll get started right away. Allison's pelvic exam yielded evidence of vaginal trauma, perforated hymen, mucosal tear, severe edema, swelling, all clear evidence of sexual assault.
Timeline?
Yeah, the status of the bruising indicates the trauma took place about 5 to 7 days ago, consistent with the incubation period of the encephalitis.
Poor baby. All right, I'll activate the rape protocols and notify PD. This case is now a crime.
We'll talk to the parents about what comes next.
All right.
Thanks, Miss Cohen.
Mm-hmm.
The trauma nurse won't let me be in there with her.
It's protocol. Just while they're collecting evidence. It won't be long, though.
I'm gonna go get a cup of coffee. You want one?
No. Wait. Can I ask you something, Dr. Manning?
Of course.
Could you be having unprotected sex regularly with someone with herpes and not catch it? Not even be aware that they have it?
Yes.
I don't want to believe it could be true, but the only person who was alone with Allie in the past week was Kevin. I can't think of anyone else it might have been.
Miss Nicholson, you can be with your daughter now.
Thank you. I'm just being paranoid, right?
I suppose I can't talk to the girl for some time.
No. The mom thinks his stepdad might have done it.
Wouldn't surprise me. That's where I was going to start. I spoke to the parents together and independently.
And?
I don't like the stepdad for the guy. He offered to give a polygraph and submit his DNA. Offenders don't usually behave that way.
Any other leads?
Allison's comprehensive tox screen detected trace amounts of triazolam in her blood. That's a benzo, right?
Yeah, a sedative hypnotic with amnestic properties.
Stepdad's an accountant. I don't see him getting his hands on that.
Well, unless maybe he's prescribed it. I mean, it is sometimes used for insomnia.
Yeah, it definitely puts you out. The hospital uses it mostly to treat patient anxiety, usually before procedures, MRI scans, things like that.
Yeah, so she could have gotten it here. Did you give it to her before the CT scan?
No.
No.
Another doctor then, maybe. Did the mom mention any other recent medical issues?
No, nothing. Other than the symptoms that brought her in today. Braces. Allison did just get her braces on.
Dentists also sometimes use triazolam.
Doctor? Doctor?
What is it?
She's awake. She's awake.
Breathing trial looks good.
I'm gonna take this tube out, okay, Allison? All right. You ready? It's okay. Breathe in. There you go. Okay.
Where am I? You got sick, honey. We had to take you to the hospital. How long am I gonna be here? I don't want to miss the school dance. Oh, sweetie. Hi, baby. The orthodontist. I was in the waiting room the whole time just checking my emails. When she came out, she smiled, showed me her braces didn't seem any different.
The police suspect instead of nitrous, he used triazolam. It knocked her out, ensured she had no memory of the assault.
Sick bastard.
I know this is a lot to process, but once Allison is stronger, the detective would like to come in and ask her a few questions.
Look, Allie just had a brush with death, and all she cares about is if she can still go to the junior high dance. She's so innocent. I don't want to take that from her. One day we'll have to, but not today.
We understand. We'll be back in the morning to check on her.
Yow.
Fever. Does that mean I have it?
You have a rash? Come on.
It's from my new bathing suit. I've had it a week.
Yeah. Does your neck hurt? If it does, you get the trifecta.
It's nothing. I pulled it trying to do a 3.5 tuck.
Where are your parents?
We live in Chicago. I'm here with my coach. I wanted to see what you were writing.
Go like this? Not like this.
Maybe something systemic.
Or maybe it's meningitis.
She's had the rash a week. If it was this meningitis, she'd be dead by now.
You guys figure we're done down there? The 800 people milling around are just waiting for the bathroom?
12-year-old female, fever, rash, neck pain. It's not meningitis.
It's the definition of meningitis.
Sure, pus in the spinal canal makes it hurt to move your head up and down, but her neck only hurts moving side to side.
Oh, side to side.
Doesn't fit.
The three of you lobby now.
Those little pills you're passing out so efficiently aren't going to do Miss Leganis squat.
You just don't want to deal with the epidemic.
That's right. I'm subjecting a 12-year-old to a battery of dangerous and invasive tests to avoid being bored. Okay, maybe I would do that, but I'm not. If it turns out she's got meningitis, you're right, you win. But if we go back downstairs and she dies, your face will be so red.
You have 1 hour.
Hey. Hey. You okay? How's your head feeling?
She's got a headache and she's dizzy.
She shouldn't have been moved after the procedure. I'm sorry.
Fine. What did the test show?
No meningitis and no other infections.
But you're not carrying a blue form. Something else, don't I?
Something's causing you symptoms. We're gonna keep you here overnight. I know it's a little crazy in here, but hopefully you'll settle down and we'll be able to get you a room.
I'm sorry. I'm not usually all emotional like this.
You're doing great. Your folks land in a few hours.
I haven't slept. I'm so tired. Oh my God, my eye's bleeding. What is it? What's happening?
Oh, don't worry. The antibiotic we gave you in case you had meningitis can turn your tears reddish. That's not blood. That's blood.
So when do they think you're getting out of here?
I don't know.
You don't look sick.
Better hope you're not. This equipment looks like it's 100 years old.
Just got it out of storage. It is the previous generation, but it works just fine. Could you guys give us a sec?
If it's good news, you can tell them.
Okay. We're pretty sure it's not cancer.
Hey, that's great.
I'll call your parents.
Well, we still can't release her. We still don't know yet exactly what's causing it. Oops. Mary?
What's wrong?
She's
She's having an absence seizure. Mary, you okay?
She looks fine.
I need some help over here. Push 2 milligrams, Ativan, stat.
Are you sure it was an absence seizure?
Absolutely. She was totally unresponsive and unaware of what was going on around her.
Do you mind? We're trying to work.
We should get back out there. Cuddy's gonna be looking for us.
Looking but not finding. Did you do an EEG?
Seizure frequency is increasing. They're almost constant now, 5 in the last half hour.
Which tells us
It's definitely in her brain.
And it's getting worse.
And? Good Lord, are you having a bowel movement or a baby?
Could be barbiturate withdrawal.
Nah, can't be drugs. She's tested at every meet she competes at.
A bleed in the brain could cause seizures.
Rat poison. Could also cause the neck pain.
You think she's eating off the floor of a folks' garage?
Doesn't have to be.
Who would poison a 12-year-old?
Well, let's see now. There's the 18-year-old has-been that she beat out to make nationals, the has-been's parents, jealous siblings, sociopathic swim fan, and then there's just your plain old garden variety whack job. Hey, you know what a hemorrhoid is?
No.
Well, Google it. And try some Raisin Bran instead of the donuts. Okay, do a CT scan, check for intracranial bleeding.
Not a chance. Radiology's totally swamped.
If our patient's bleeding into her brain, she's gonna be dead in 8 hours.
She could be, but a meningitis patient will be without a CT scan.
When I was in med school, I had this old professor.
Who touched you in the naughty place?
Before the CT scan was introduced, he specialized in transcranial ultrasound.
Ancient, but if there's enough bleeding, it might work. Okay, do what the guy who didn't specialize in neurology said.
It was my idea.
You're right. There's a significant bleed in her temporal lobe.
But no poisons. Did tox screens on her blood, urine, and hair. Nothing. Did them twice.
He's a little dehydrated. Put him on a saline drip and give him some orange juice.
I need an operating room and a neurosurgeon.
Oh, well, given the current crisis, I'm tempted to say no, but since you've been so sweet to me
Our
today.
little mermaid is bleeding into her temporal lobe.
How fast are you never prepped?
20 minutes.
You'll have a surgeon in the room in 10.
Have both on board.
We're missing something.
What?
If I knew that, it wouldn't be missing.
Maybe she's adopted and we've got the wrong history.
No, she's got her mom's eyes and a red patch of hair, just like Dad.
What about an allergic reaction?
Could explain the rash and muscle pain, but probably not the bleeding or seizures.
That's a lot of balloons.
You think she's allergic to polyester?
Not unless she's been competing in the nude all these years.
Then what are you thinking? What do the balloons mean?
What if the rash isn't a rash?
What are you talking about?
Who gave her the balloons?
Some of the girls from her team. I've been visiting her pretty regularly, but none of them are sick.
What about the guys?
None of them are sick either.
Which guys visited her?
Actually, none.
She's cute. She's nice. She's a kick-ass diver. I think the guys would be falling over themselves to get close to her.
She's 12. The youngest guy on her team is 16.
Okay, so maybe they're just not interested. Or
they're avoiding her.
Are there any cell fragments in her blood smears?
No. Red blood cells were intact.
Check him again.
Blood looks like it's been put through the blender now.
You done yet?
You were right. Rash wasn't a rash. She's bleeding into her skin. It's purpura.
Thrombotic thrombocytopenia purpura?
Starts with T. You were so close.
What could have set it off? She had no traces of E. coli in her culture. She's obviously not menopausal, so no estrogen.
There is one other possible cause.
Oh, God.
Pregnancy causes all kinds of chemical and biological changes in a woman's body. Or a girl's body, as the case may be. In extremely rare cases, everything goes haywire. It's called TTP. Blood starts clotting like crazy and clogs the vessels in your brain and kidneys. Red blood cells end up getting shredded as they squeeze past the clot like a fat guy in a crowded bar. I'm sure you know what that's like. I mean, you're only 12, but you're all grown up, right? Travel on your own, hang out in hotel rooms, getting room service with your teammates. Maybe someone sneaks in a couple of beers, start playing spin the bottle. Next thing you know, you're waking up with nothing on but your socks.
It wasn't like that.
Of course not. You wanted it.
Yeah, I did. He turned out to be a jerk, but
Actually, under New Jersey law, the term is felon.
I knew what I was doing.
We're gonna have to do something called plasmapheresis. It cleans the antibodies from your blood. We're also gonna have to terminate the pregnancy.
You gonna tell my parents?